That's the important question. When we started working on FH some years ago, it was quite depressing because we would try hard and we couldn't get their cholesterol levels down to normal. We'd give them a little medication, they'd come down a little bit, and then you'd follow them and they'd die of an early heart attack. In the last several years, thanks to a class of medication called HMG-CoA reductase inhibitors, these patients can receive normal levels. Now, it's not easy. You have to work hard. You have to follow them up. Most of these patients have to be seen every several months for the rest of their life, and they need reinforcement. But we have the medications available that with generally 2 medications and conscientious compliance and follow-up, we can give them either normal or relatively normal cholesterol levels, and regression angiographic studies suggest we can probably give them a relatively normal life expectancy.
We have a very broad spectrum of people with FH in terms of age. We have young children, we have elderly patients, we have middle-aged patients. Generally, people tend to think of the middle-aged patient as the one that they're going to treat or detect. Can you say or suggest, is there a too early a time to detect FH, or is there a too late a time to detect FH? If you're 75, does it matter? If you're 5, does it matter? What's the ideal time for detection?
It's never too early, and it's never too late. Now, why is it never too late? You say, well, heck, if a lady comes in and she's 69, like one of the grandmas that we were evaluating, she's already past the age for an early heart attack, so what good does it do to diagnose it in her? Easy. That lady had 25 grandkids, and those 25 grandkids have a 25% chance. So 4 or 5 or 6 of them are going to have FH. So even if an older person who's escaped the problems is going to be diagnosed, it's maybe not as important for her. She's already living a pretty good life. I mean, we'll sort of help her a little bit, but for some women who are lucky and live in older ages, that's not a problem. Now, how about young? Well, a little kid, I mean, if he knows about it, he can be helped. You may say, well, therapy is controversial from the standpoint of drugs. That's true, but smoking has a tremendous interaction with FH. And if you find one of these little kids and you tell his parents, okay, this kid has FH, you should make sure this kid never picks up smoking, which may say, hey, Mom and Dad, you're smokers, you know. This kid's 5 years of age. You've got maybe a year or 2 to stop smoking, or this kid's going to start picking up your habit. So I mean, you can start this kind of preventive approach. Dietary habits. People pick up dietary habits as they're little kids and growing up. So if this family learns as a whole family to say, okay, everybody's going to learn to drink skim milk. I mean, you don't want them to have a wacko diet where they're malnourished. They still need calcium, they still need iron, and so they learn to drink skim milk and have non-fat milk products and things like that. And so the kids grew up doing that. So there are a lot of practical things. So it's never too early and it's never too late. Now, this is probably the first time we've ever tried to implement an answer to an interesting question, and that is, okay, scientists all over the world are spending billions of dollars trying to trace down genes that cause disease. And the question is, so what? What are we going to do about it? This is an approach that takes advantage of the unique information that geneticists can learn and say, how do we apply it? And the answer is, you start with people who have the gene and you trace out and find family members and prevent them from having the serious problem that their genes lead to but don't have to lead to. That's the important thing.